Hypertrophic cardiomyopathy is a condition where the walls of your heart thicken, often caused by an abnormal gene. In order to understand this condition, it's important to know the main parts of your heart. Your heart has 4 chambers. They are the right atrium, the right ventricle, the left atrium, and the left ventricle. A muscular wall called the septum divides the 2 sides of your heart. Your heart pumps blood in one direction through 4 valves. They are the tricuspid valve, pulmonary valve, mitral valve, and aortic valve. The job of your heart's left ventricle is to pump oxygenated blood throughout your body. This provides your body with the oxygen and nutrients it needs. Hypertrophic cardiomyopathy usually affects your left ventricle by thickening its walls. This happens because your heart muscle cells grow bigger. In some people, scar tissue may form between the muscle cells over time. Even though your cells are bigger, your heart stays about the same size. As a result, your left ventricle can't hold as much blood. The left ventricle may also become stiffer, contract harder, and relax less between contractions. These problems make it harder for your heart to fill and pump more blood as is needed during exercise. Hypertrophic cardiomyopathy can be non-obstructive or obstructive. If you have non-obstructive hypertrophic cardiomyopathy, your heart has thickened walls, but the walls and mitral valve do not block blood flow out of your left ventricle. In obstructive hypertrophic cardiomyopathy, the heart has thickened walls as well, but the septum may bulge into the path where blood leaves the left ventricle, called the outflow tract. During contraction of the heart muscle, the mitral valve is pushed toward the septum, which narrows the outflow tract and may prevent closing of the mitral valve. This can cause backflow of blood into your left atrium. The size of the outflow tract may change during the day. It may become narrower or widen based on your activity. A narrowed outflow tract means more pressure and heart work are needed to push blood out of your left ventricle to your body. This pressure difference is called gradient. Symptoms of hypertrophic cardiomyopathy, with or without obstruction, typically include tiredness and shortness of breath, chest pain, lightheadedness, heart pounding, or fainting. Talk to your healthcare provider if you have any of these symptoms or other questions about hypertrophic cardiomyopathy.